Traore is unveiling arguably the most ambitious hospital project Burkina Faso has ever seen. This is an insane 17-building, 500-bed healthcare monster, rising 3 floors high with a massive $108 million budget, built without a single World Bank loan. Step past the entrance, and they've already installed automated appointment systems across the facility, ready to manage incoming patients. Just look at the sheer scale of this medical complex. Run your eyes from the left edge all the way to the right. That entire sprawling compound, all of it, is a single hospital. Meanwhile, watch closely. This man is struggling to position the microphone before Mr. President begins to speak. Everyone was waiting to hear what he had to say. What followed was the unveiling of something much bigger. These are moments from December 24th, 2025, as Traore stood at the inauguration of the CHU de Pala, Centre Hospitalier Universitaire de Pala, in Bobo-Dioulasso, marking the official opening of the hospital. In his speech, Traore didn't stop at thanking China, whose funding made the new hospital possible. Instead, he quickly announced 9 more hospitals of the same high-standard model across Burkina Faso.
This is something we can be proud of. And I think the doctors, just a little while ago, were still expressing their concerns. They said they would like to see this type of hospital built in different parts of Burkina Faso. And based on the example that the People's Republic of China has given us, we, at the government level, have also taken the decision to build 9 more hospitals like this across Burkina Faso.
Nous avons pris la décision aussi au niveau du gouvernement d'en construire 9 pareils au Burkina Faso.
We will most likely start with Fada and Gourma, if I'm not mistaken. And progressively, the objective is to expand our medical infrastructure and technical capacity so that our doctors and nurses can truly demonstrate what they are capable of.
Now, follow the map southwest to Gaoua. Another hospital was already rising there, and by June 2026, it had reached 92% completion. But here lies a deliberate geopolitical move behind these walls that I'm about to reveal, one that Western analysts missed entirely. Burkina Faso is landlocked in West Africa's Sahel region, wedged between Mali, Niger, and 4 coastal neighbors. For most of the last decade, headlines about this country have been about one thing: a security crisis, an insurgency that's pushed roughly 2 million people from their homes. So, a 500-bed hospital going up in the country's second-largest city is not the story anyone expected to be writing right now. Keep your eyes on this date, May 26, 2018. Burkina Faso restores diplomatic relations with China, ending 24 years of recognizing Taiwan instead. That single date matters more than it looks like it should, because the hospital you just watched open its doors was promised on that exact day. China's Ministry of Commerce committed 60 billion CFA francs. That works out to roughly $108 million in today's money. A hospital chosen as the opening gift of a restored friendship. That's not incidental. That's the whole plot. But this is where the story takes a surprising turn. The original site for this hospital wasn't Pala at all. It was inside the Kua forest, a stretch of protected land on the edge of Bobo-Dioulasso, classified since 1936, nearly as old as colonial-era Burkina Faso itself. In April 2019, the Municipal Council of Bobo-Dioulasso voted to strip protection from a chunk of that forest, 160,000 square meters, about 16 hectares, to clear space for the new hospital. And that's when the fight started.
We had been hearing about what was happening. We were told that a hospital was going to be built inside our classified forest. We heard about it on social media, but there was nothing we could do. But today, we came here and visited the site. We are reassured. And we have now confirmed that it is indeed true. At this point, we cannot make any decision ourselves. The elders are here, and we need to consult with them.
178 Burkina Faso citizens signed an open letter straight to the president of Faso, asking the government to reconsider. Environmental lawyers argued the municipal council never had the legal authority to declassify a state-protected forest in the first place. Only the full council of ministers could do that. Picture the stakes here. This forest sits over what's described as West Africa's second-largest groundwater table. Build wrong, and you're not just cutting down trees. You're risking contamination of water an entire region depends on.
We have come here to say no to the declassification of the Gaoua forest for the construction of the hospital. That is essentially what we can do. Stand alongside our forest officers and support them.
We understood that they were simply refusing to listen, so our colleagues, supporters, and everyone who cares about nature decided that today, everyone would come here. We would stand together and tell them that we do not agree.
For 18 months, this fight went nowhere. Then, on August 13th, 2020, the Prime Minister at the time, Christophe Dabiré, stood in Bobo-Dioulasso and announced the government's own reversal. The hospital would not go in Gaoua forest. It would move to the village of Pala instead. The government's own environmental impact study had recommended against the original site. And organized public pressure is the reason that study got taken seriously. That's not a footnote you'd expect in a hospital construction story. That's a government publicly overruling itself. 2 months later, on October 20th, 2020, in the village of Pala, the ceremonial first stone is laid. In remarks read on her behalf, then Health Minister Léonie Claudine Luguet credited then-President Roch-Marc Christian Kaboré's push for the project, noting that the hospital predates Burkina Faso's current government by roughly 2 years. Whatever comes next belongs to more than one administration. The design work went to a Chinese state institute, the China Aviation Planning and Design Institute. Blueprints reached Burkina officials in April 2021, got Chinese side approval 2 months later, and by September 2021, a company called Beijing Urban Construction Group won the bid to actually build it. Formal construction didn't start until December 23, 2021, more than a year after that ceremonial first stone. By October 2023, construction crews capped the roof of a water tower nearly 34 meters tall. That was the marker that the main structural work across all 17 buildings on the site was essentially done. And for a while, this project was running ahead of schedule. April 2024, touring ministers record 80% physical completion against just 73% of the allotted construction time. The site coordinator tells reporters delivery is expected by March 2025 at the latest. That promise didn't hold. January 24th, 2025. Prime Minister Rimtalba Jean-Emmanuel Ouedraogo walks the site in person. The main hospital building itself, 98% complete. And he's satisfied with that. But the radiotherapy center next door, meant to open alongside it, is running roughly 27 months behind its own schedule. Watch what he says next, because it's not the kind of line governments usually put on the record. He tells the contractor in public that no company can afford the luxury of delay while the Burkina state, under real wartime pressure from the security crisis, is meeting its own obligations. He demands a firm commitment. Finished by June 2025, that radiotherapy center had its own 5-year struggle, separate from the main hospital. Ground was broken the same day in October 2020. By April 2023, 5 months past its original delivery date, it sat at just 25% complete. The health minister himself called the situation very mixed. The stated cause, a mix of the security situation and financing trouble on the contractor's side. Financing for that piece came through an Austrian partnership, AME International GmbH and Unicredit Bank Austria, at a cost of roughly 9.8 billion CFA francs. So track what actually happened here. A government publicly reversed its own site decision under pressure, then publicly called out its own contractor for missing a deadline twice. This isn't a propaganda reel. This is a construction story with real friction in it. And that's exactly why what happened next matters more. December 24th, 2025. 6 independent outlets, lefaso.net, the state wire agency AIB, National Daily Sidwaya, Wakat Sera, APA News, and librainfo.net all confirmed the same event on the same day. President Ibrahim Traoré personally cuts the ribbon on the CHU de Pala and its radiotherapy center, flanked by the Prime Minister, the Health Minister, and Chinese Ambassador Zhao Deyong. Look at the numbers on screen now, because this is where the scale becomes real. 500 beds, 90 consultation rooms, 11 elevators, an intensive care unit, 42,000 square meters of floor space spread across 17 buildings on an initial 17-hectare footprint that's expandable to 30. The design is vertical, 3 stories ground plus 2, specifically chosen to conserve land for future growth. The equipment inside, an MRI unit, an 80-slice CT scanner, and, singled out by the health minister himself as the newest generation model of its kind, a Siemens interventional imaging suite for cerebral and cardiovascular procedures. He calls it the first installation of this specific model anywhere in the sub-region. That's his own claim, made at the ceremony. Chinese medical equipment supplier Haier Biomedical says it delivered the hospital's entire equipment package, 133 categories, 2,188 individual units and systems, covering everything from surgery to pediatrics to the operating theaters themselves. And just beyond the main clinical spaces, another detail makes the hospital feel less like a construction project and more like a functioning healthcare system. Automated appointment machines are positioned to handle patient registration and appointments.
So when you come here, maybe even if the staff is not available, you can just use the equipment and to put your problem and get like some kind of appointment. So if you will have the appointment, they can just call you with the machine and show you the room in which you should go to meet the doctor.
Now watch the health minister's face as he adds one more line, almost in passing. He notes that the ground this hospital now stands on was, only a few years ago, just forest. He doesn't name CHU directly. He doesn't have to. Everyone in that crowd who followed this story for 6 years knows exactly what he's referring to. Total construction time, groundbreaking to opening, 3 years and 8 months. Here's a number that shifted, and no single source explains why. In 2018, and again at the 2024 site visit, the project's cost is consistently described as roughly 60 billion CFA francs, about 108.6 million US dollars. By the December 2025 opening, at least 4 separate outlets are reporting more than 70 billion CFA francs, closer to 125 million US dollars. That's a jump of about 17%, and nothing in the public record explains it directly. It could be added costs from the radiotherapy center, it could be currency shifts, it could be simple inconsistency in reporting across 5 years. We're not going to guess. We're putting both numbers on your screen because that's more honest than picking one. No World Bank or African Development Bank financing applies to this specific facility. This is a Chinese government grant, not a loan, administered through China's Ministry of Commerce, part of the broader bilateral relationship restored in 2018. And now, the moment the entire opening ceremony was building toward, Traore doesn't just thank the crowd and walk off. He picks up the microphone and says the government has decided to build 9 more hospitals of this exact standard nationwide, starting in Fada Ngourma in the country's east. One hospital opening becomes a 10-hospital national program, announced in the same breath. You'd expect that kind of announcement to be pure political theater, a big number thrown out for headlines, then quietly forgotten. Follow what actually happened next. Here's the detail that changes how you should read everything else in this video. The 9 hospitals program didn't start with that December speech. It started 2 years before it. November 30th, 2023. More than 2 years before Pala's ribbon cutting, President Traore personally laid the first stone of a second hospital in the town of Gaoua, in Burkina Faso southwest. Trace it on the map. This connects the country's second city to its far southwest, right at the border zone with Côte d'Ivoire. That's deliberate. CHU Gaoua is explicitly designed to draw patients across that border, serving the Sud-Ouest region as a genuine regional hub, not just a national one.
Voilà, on a eu le pot de la première prêt par son excellence camarade Ibrahim Traoré, qui a voulu penser à la population du Sud-Ouest pour pouvoir vraiment nous aider à éloigner les épidémies et d'autres maladies. Vraiment, nous sommes très fiers. Et bon, nous demandons aussi aux membres de l'entreprise de bien faire les choses comme il se doit. Parce que nous ne voulons pas des infrastructures.
Watch the progress numbers here, because this is the part that's easy to miss and genuinely remarkable. As of an August 2025 site visit, Gaoua sat at just under 55% complete. By the Prime Minister's next visit, June 21st, 2026, it had jumped to 92%, confirmed independently by 4 separate outlets, including the Prime Minister's own office. Contractual delivery is fixed for December 2026, and the project director has publicly floated the possibility of finishing early. And there is another visual from Gaoua worth holding on screen. Traore himself is shown at the construction site, placing one brick onto another with his own hands. For a moment, the 92% figure becomes something physical, a hospital taking shape directly in front of him. 306 beds, 36 buildings, built by a contractor called Ellipse Projects. But here's where the story takes an unexpected turn, with a detail that's easy to miss. The hemodialysis unit at Gaoua was already treating patients months before the main hospital building was finished.
Avant le déplacement de Kamti, le ministre de la Santé a inauguré le centre d'hémodialyse du centre hospitalier régional de Gaoua.
Burkina Faso's own December 2025 year-end review confirms that the unit was already operational alongside the progress at Pala. In other words, care had already begun before the hospital itself was ready for its ribbon cutting.
Merci à son Excellence, Monsieur le Président du Faso, le capitaine Ibrahim Traoré. Je pense que ce garçon-là, c'est vraiment une bénédiction de Dieu.
This is not a promise sitting in a press release. This is a second hospital, 92% physically real, on a fixed December 2026 delivery date. The rollout doesn't stop at 2. In his December 31st, 2025 year-end national address, Traore confirmed that 2026 will see groundbreakings for the remaining hospitals in the image of Pala. Burkina 24 independently corroborated that address 6 days later. By March 2026, the health minister told the sector's official planning session that the 9-hospital program is formally underway, alongside a new National Heart Institute whose own groundbreaking is imminent. Fadan Gourma, the town Traore named specifically in his announcement, is confirmed as the government's next formal launch target for 2026. Though, as of the most recent reporting, no groundbreaking date or contractor has been publicly named yet. Worth being precise here. That town has already seen other investment arrive ahead of the hospital itself. Road paving through the National Faso Mabo program, and in July 2026, a military mobile field hospital deployed there for displaced families. That's real activity in Fadan Gourma right now, just not the CHU project specifically. Not yet. That mobile hospital is more than a response on the map. It is a reminder that, in a country facing a security crisis, care sometimes has to reach people before permanent infrastructure can. And that reality becomes deeply human in footage of Traore visiting wounded soldiers at military hospital Tenguet Ouattara at Camp Ouedzin Coulibaly. For a moment, the story moves from hospitals still being built to people already carrying the cost of the crisis, wounded patients, and the medical team standing beside them. Zoom out on that same February 2026 government briefing, because the hospitals are one piece of a bigger health push happening at the same time. 20 new community health clinics built, 25 more upgraded to full medical centers, 2,000 health workers newly specialized under a national training plan, 15 million mosquito nets distributed, 750,000 infants fully vaccinated. New dialysis centers planned for 3 more towns. After spending minutes tracking hospitals, budgets, equipment, and completion rates, this kind of footage brings the story back to one person standing in front of another. The projects are national in scale, but their meaning is ultimately measured at that human level. Before the next piece of this story, the part where this same country tried this exact move once already 15 years ago with a completely different foreign partner. Here's a quick ask. If this kind of on-the-ground infrastructure tracking is useful to you, hit like. Subscribe to AfriTransformation. It genuinely helps our small team keep pulling primary documents and cross-checking claims instead of just repeating headlines. Step back for a moment, because there's a detail buried in Burkina Faso's own history that reframes everything you just watched. This isn't the first time a foreign government built this country a flagship hospital to open a new relationship. 15 years earlier, on the other side of the country in Ouagadougou, a 600-bed national hospital opened, bigger than Pala by bed count. 19 operating theaters, 16 hectares of land. First stone laid July 2007. Ribbon cut October 25, 2010 by then President Blaise Compaoré himself. The financing partner wasn't China, it was Taiwan. A $60 million bank loan, not a grant, funding roughly 45 billion CFA francs of construction, meant to be repaid, not a gift. Burkina Faso recognized Taiwan instead of Beijing from 1994 until 2018, a full 24 years. When the country switched allegiance back to China in May 2018, that older hospital didn't just sit there quietly. In August 2018, the same year China came back, Burkina Faso's Council of Ministers formally renamed it. It had been called the Hôpital National Blaise Compaoré, after the president who championed the Taiwan alignment. It became CHU de Tengendogo, the old name and the old political relationship attached to it quietly erased. Same country, 2 flagship hospitals, 2 different foreign partners, 15 years and 1 geopolitical reversal apart. That's not a coincidence you need us to spell out for you. It's right there in the dates. So here's what this story actually is, once you connect every piece of it. This isn't a country receiving foreign charity and putting on a ribbon cutting for the cameras. Watch the pattern again. A government that reversed its own construction decision after public pressure. A prime minister who publicly disciplined a foreign contractor for missing a deadline on the record in the middle of an active security crisis. A president who used his own hospital's opening ceremony not to accept a gift quietly, but to announce 9 more demands for the same standard nationwide, and then quietly delivered a second one ahead of the cameras, 92% complete, months before anyone was watching. That's not a hospital story. That's a country using foreign financing as raw material for a domestic infrastructure program it controls the terms of, reversing site decisions, enforcing deadlines, and stacking multiple foreign and international partners against a single national blueprint it wrote itself. China funded Pala. Austria funded the radiotherapy wing next door. A separate contractor is building Gaoua. 3 different partners, one government set standard, applied consistently across every project. And throughout all of this, the security reality never disappears. In footage from the construction work, Traore keeps his pistol with him even while taking part in the building activity. It is a small visual detail, but it sits against the larger story. Civilian hospitals are being built while the country's leadership continues operating under a serious security threat.